problem in pediatrics, which is different from adult patients, is that we don't like to be invasive. We don't do bronchoscopies. In adult patients, you can do bronchoscopy just with a patient with a little bit of local anesthesia. In children, it's impossible. So we don't know what's happening in the airways in children. And this is where we lag a lot behind what adult internal medicine colleagues do. I think really we desperately need to understand which of the children, which child is going to be at risk, which the child where we don't have to worry. And not tell parents, in 3 years' time or in 4 years' time we'll be able to tell you, because then it may be too late to initiate the right treatment. The societal costs of asthma are quite humongous. It's a chronic disease. You have to treat for long, long times. You have hospital admissions and so on and so forth. If you could prevent this at the first time, that would be, I think, a win to families, but also to the society. And as a pediatrician, vaccination is part of our job. And we know that certain infections can really exacerbate asthma. Whooping cough is one of them. RSV, there is no active vaccination, but there's passive vaccination in children at risk. And we would love to have a vaccination for rhinovirus, because we know that rhinovirus is one of the most severe and most frequent causes of exacerbation. And if we could just vaccinate, then these exacerbations may be much less. I think more than sharing data, we need interdisciplinarity, which is so hard to do. We need clinicians, we need epidemiologists, we need immunologists, we need geneticists, we need people who can handle these increasingly large data sets. And we need groups of people. I don't think that research these days is made in a laboratory with a little mouse. And this is, the WHO effect. We need to translate from the mouse to the human. We need to find ways how we measure in patients, how we also measure in healthy children. So we need the whole broad interdisciplinary approach, and I think this is crucial for the future. The problem with some of the new developments in asthma treatment, these biologicals, which have shown great promise in adults, are incredibly expensive. And so you can only limit those to a few patients. Yes, you want to target the severe asthmatics. There are not too many. Nevertheless, these costs are prohibitive. And if you want then to bring this down to children, how long are you going to treat those children? What the costs are going to be? Some of these shots cost 5,000 euros. Imagine, you would have to do this in a chronic illness over 20 years, 30 years' time. I think that's a real issue. And how can we bring those medicines to cost to the children in need, to the patients in need, to the adults in need, without having to explode, the healthcare system?